Hello lovely viewers, you welcome back to the Guided Midwife channel. My name is Aisha and I'm a registered midwife. On this particular platform or this channel, we talk about everything preconception, pregnancy, labor and postpartum. So please, if you find this channel very educative and interesting, then please don't forget to subscribe. You can also tap on your notification bar to get an alert anytime I post a video. So on today's episode, I'm going to talk about the drugs we prescribe for pregnant women when they visit the clinic or when they come to the ANC. So as a pregnant woman, there are some medications or drugs that are very harmful to you and your baby as well. So maybe when you were not pregnant, you were taking some medication, or maybe you were on some medication that you've been taking on daily basis. But the moment you get pregnant, maybe that drug should not be taken when you have a baby in your uterus because it can hurt or it can harm the baby in the uterus. But that's not the case. What I'm trying to say is that when you are pregnant, you shouldn't be taking unprescribed drug. When we come to the ANC, there are some medications we prescribe for the pregnant women when they come for their visit. We call it like the routine drugs. That's the Folic, the folic acid, the vitamin C, and at times calcium. Pregnant women need some kind of multivitamin or vitamins in their system to enable the baby to develop very well. These vitamins are at times found in foods and other stuffs, but we want to supplement it because lack of this or lack of some of these vitamins can cause some congenital abnormalities in your baby. So I'm going to talk about one particular vitamin, that's the folic acid. The folic acid is very, very good, and even if you're not pregnant, we educate women in general to be taking folic acid daily. That's 5 milligrams a day. And as a woman, every month you'll be seeing blood, and it kind of replenishes the lost blood. So folic acid is very, very, very vital. And folic acid is very important during pregnancy. The intake of folic acid is very, very important during pregnancy. Why? Because as humans, during the developmental stages, when you are in the uterus, we have something called the neural tube. Everybody has a neural tube, but a defect in it can cause a congenital abnormality. So during the early stages in pregnancy, that's the first trimester, that's the first month to the third month, there's a whole lot of cell division that goes on. That's where the fetal structures are being laid down. So we call that stage the critical stage. So at that point, we have something called the neural tube, which helps in the development of the brain and the spinal cord. So lack of folic acid can cause a defect. There are so many types of this neural tube defect. We have the spina bifida, that's a defect in the spinal cord, and anencephaly, that's a defect in the brain, and encephalocele, that's when the neural tube is unable to close. So I'm going to show pictures of this neural tube defect, that's the anencephaly, encephalocele, and the spina bifida at the end of this particular episode of video. So when you say spina bifida, it's when the baby or the fetus spinal cord is unable to develop completely. This spinal cord protrudes outside the skin of the baby, covered with a tissue. So these babies kind of die right after birth. Some of them. Others too live for like 2 or 3 hours, then they just die off. Others too live for weeks. Others undergo some surgical procedures, and these babies can't walk and will live their whole life in a wheelchair. So it's a very, very serious condition, just lack of folic acid intake. And when the anencephaly, the baby is born with parts of the brain and the skull. So the baby's brain is not completely formed. So at times, right after delivery with an unaided eye, you could see the baby's brain, it's partially formed, same as the skull. I'll be showing pictures so you see them. So this as a result of lack of folic acid intake. So 75% of these babies die during the labor process, because during labor, with a normal delivery, the head of the baby comes first, and you know this, the head helps in the dilation of the cervix. So because the skull and the brain is not completely formed, it's kind of, the pressure is being exerted on the brain and the skull of the baby, and you know these babies at times, most of them come out dead. Yeah, they die during the delivery processes. And these babies, like, you know, they can't stay because they have this incomplete formation of the skull and the brain. They just die, or they just can't live. So per assessment, like right after delivery of a baby with anencephaly, you could see that there is no skull at the upper part of the head. You could see the brain, you could feel the brain, you could feel some pulses there. And these babies die right after birth. In a case report, I think the longest baby with anencephaly lived for like 2 years, 4 months. And it's not here in Ghana, it's in the advanced countries. They supported the baby with some life-saving machines, and the baby lived for like 2 years, 4 months. So it's a very, very, very serious condition. So encephalocele is also a neural tube defect. But with the encephalocele, there is a complete formation of the brain, but the neural tube refuses or does not close, leading to the protrusion of the membranes of the brain through the skull, forming a different head. So you could see clearly from a picture that a baby has two heads. The baby has an initial head, that's the first head, and a different one. And so it's due to the neural tube not being able to close. So these membranes bulges through, it's like it herniates through that skull, forming a different head. So that second head doesn't have any eyes, nose, or mouth or anything, but it's very soft, and at times it's covered by hairs, and we have a surgical procedure to correct that. This surgical procedure is done in infancy. That's when the head or the skull is very soft and kind of it's flexible. But when a baby grows with it or becomes an adult, it becomes very difficult. So this encephalocele is corrected during infancy. So you could see that folic acid is very, very vital or very important during pregnancy, because lack of this folic acid in your system is definitely going to cause a neural tube defect. That's the anencephaly, the encephalocele, and the spina bifida. Intake of folic acid during pregnancy should be a priority to our pregnant women, because a deficiency in this folic acid in your system can cause a neural tube defect. And you know something, folic acid also helps prevent anemia. And if you want to get pregnant too, you should be taking folic acid before, like, you know, the preconception care, as I said earlier on. So as a woman who is pregnant or not, the dosage for folic acid should be 5 milligram daily. It shouldn't be more than 5, neither should it be less than 5. And you know, there are so many companies that manufacture this folic acid. Others, the dosage of this folic acid is not up to that 5 milligram. Others are 4.5, 4.7, but the required amount for this folic acid should be 5 milligram daily. So our lovely viewers, I hope you find this video very educative, and I'm urging my viewers to please subscribe to my channel, and don't forget to hit on the notification bar to get an alert anytime I post a video. So on the next episode, I'm going to talk about festulate, the importance of taking festulate. Thank you. Stay tuned. Bye. And this is a picture of a baby with a spina bifida. So this is called the encephalocele. That's a type of neural tube defect due to deficiency in folic acid in your system. And this is also a picture of a baby with anencephaly.